and my glass. Do my hand hygiene here. Okay. All right. Okay, so now I'm going to go reassess my patient and get ready to give him his insulin. He should be feeling better, so we're going to be hopeful that he does. So I'm going to go in my patient's room. Knock, knock.
Come in.
Mr. Meyer, how are you feeling?
Oh my goodness, that's a miracle medicine. I feel
good.
much better.
You're feeling better. Very good. You feel like you might want to eat breakfast now?
Yes, I think I could.
Okay, well, I'm going to check your blood sugar here in a second and go get your insulin for you. Can you tell me your name and date of birth, please?
Dan Meyer, 7/28/22.
Okay, are you allergic to anything?
Penicillin.
Penicillin, okay. I'm going to check his blood sugar.
Okay, his current blood sugar is 202.
202, okay. Well, I'm going to go get you some insulin. If I recall, it looks like you're going to need some regular insulin as well to cover that higher blood sugar. So I'll be right back.
Okay, thank you.
All right, so we're going to step out. I'm going to pull up my patient's MAR and see what we're going to give. I'm so glad that he's feeling better. Continue with phase 1. Go to my MAR. Okay, his sugar was 202. So on my regular insulin, this is my sliding scale, it looks like he's going to get 6 units of regular insulin for a sugar of 202. He will also get his NPH 12 units, so he's going to get 12 and 6.
Okay, for a total of?
18.
Very good.
All right, so I'm going to pull out my regular insulin here, regular insulin. Okay. My NPH here, all right, and then I'm going to get me an insulin syringe. Okay, now, when we draw up insulin, it's always clear first, then cloudy.
Okay.
You guys will have you will have learned that already. So I'm going to X out of this. I've done my 1 med check there. Any questions about insulin?
Yes, what is the onset, peak, and duration for your regular insulin?
Oh, okay. And I made myself notes. So regular insulin, I expect the onset to be within 30 to 60 minutes, so it's pretty quick, which is
Okay.
why we like to have them to have their tray before we dose them. It will peak in 2 to 4 hours, and then the duration is 5 to 7 hours. What we're concerned with when giving insulin is hypoglycemia. So we're going to be monitoring for those signs and symptoms of hypoglycemia, which include diaphoresis, tachycardia, just not feeling well.
Okay.
That's what I'm going to be looking for when I give these medications.
Very good.
Knock, knock.
Come in.
Mr. Meyer.
Yes.
It's Angie again.
Oh, good. Did you bring my breakfast?
I am getting your breakfast. I think the trays are on the way. I'm going to give you your insulin real quickly and then let you eat your breakfast. You don't need this anymore, do you?
I don't. I feel so much better. Thank you.
Very good. Very good. All right. So, name and date of birth, please, sir.
Dan Meyer, 7/28/22.
Okay. And allergies.
Penicillin.
Penicillin. Okay. So I'm going to pull up my patient's MAR. I brought in an insulin syringe. You can only give insulin using an insulin syringe. Continue with phase 1. Here. Go to my MAR. All right. And my sugar was 202. I'm going to recheck this again. 202, I'm going to give 6 units of regular, and I'm going to give 12 units of NPH.
Okay.
So what I want to do first is scan my medication. This is going to be my second check. Got my Humulin N, NPH, 12 units, yes. And then I've got my regular with a glucose of 202. I'm going to give 6 units. Yes, okay. So I'm going to scan my patient and scan my medications. I'm going to start with my NPH. The same process as what we did with the ondansetron. I'm going to scan my patient's bracelet first, and then I will scan my medication. I'm going to scan your bracelet here.
Okay.
All right, and it comes up Dan Meyer. I have the right patient. And then my medication barcode for my NPH. I've got my green verified there. I'm giving 12 units. And then I'm going to put in my initials there and save. Okay, and then I'm going to get my regular out and do that. So I'm going to click on my little green globe here and scan my patient. Okay, Dan Meyer, it's the correct patient, and then I'm going to click on my medication barcode and scan my insulin. I'm giving regular. And if you're not sure which one you've clicked on, you can look up there. Okay, and so here is my sliding scale there. 8:15. So I'm going to put down here that I'm gave 6 units. Insulin is always dosed in units. And my initials and save. Okay, so how we're going to draw up this insulin. We've got our NPH, so and it's cloudy.
Okay.
So what I want to do is just gently roll that in my hands to make sure that it's mixed up well before I do anything else. Okay? Then I'm going to take out my regular. We always draw up clear first, then cloudy. Clear first, then cloudy. So I'm going to clean the tops of my medication vials here. I've got my insulin syringe, and I need to add air to my NPH first because I'm going to be drawing up my regular first, so I want to go ahead and add my air to this one first. So
Okay.
how many units am I giving of NPH? I'm going to give 12. So I'm going to draw this up to 12 and inject my air into my NPH. Okay, and I'm giving 6 of regular, so I'm going to draw up my regular here and inject. Then I'm going to draw up 6 units of regular insulin. And I've got a little air bubble in there. Try to get rid of that. Okay. Okay, I have 6
Yes.
of regular. So then I'm going to now draw up my 12 of NPH. You have to be very careful with this because if I mess up, I cannot inject this back into here because I've already got regular in here. So I've got to pull this back to 18 to make my 12. So I'm going to go slow. There I'm at 10, 12, 14, 16, 18. 18 units total. 12 of NPH, 6 of regular.
Very good.
All right, I'm going to recap this so I can put on my gloves. I do the one-handed scoop there. Get my gloves and inject this. Miss Lindsay, where would you like for me to give this medication?
We'll give it in the back of the right arm.
Okay.
Why is it important to ask your patient where they would like their insulin given?
Because if they are taking insulin at home, we run into the problem of them consistently dosing in their abdomen all the time, and that's because it's easy access for them. If we continue to do that, they can develop some scarring in that tissue, and then the insulin will not absorb like it's supposed to. So we like to rotate these sites. So we ask them where they take it at home so that we can try to avoid that and reserve that for them at home, and then we want to rotate that while they're here. So, if I ask Mr. Meyer, where did they give your insulin last?
They gave it in my left arm.
In your left arm? Then this time I'd want to do it in his right arm. Okay, is that all right with you, Miss Lindsay?
Yes, ma'am.
Okay, I'm going to landmark this site. In the arm, I'm going to give it right back here in this nice fatty area because that's where we need it to be sub-Q, right in here. Now, I don't have anywhere to inject it there, but this is where I would landmark and I would inject. I can inject down here. And MedPass will have maybe one here, an injection pad that you can inject it there, but we just want you to tell us where is the appropriate site to inject that.
Okay.
But I'm going to give my sub-Q, and how I like to do this, we do not aspirate, but you can either go in at a 45-degree angle,
Okay.
or you can bunch up the fat like this and go straight in, which is the way I prefer. So I bunch that up, I'm going to go straight in, And I do not aspirate, and I just inject straight out.
Okay,
And that is it.
very good.
You do not recap a dirty needle, so you're not going to see me recap this. I'm going to take it straight over here and dispose of it. Mr. Meyer, are you feeling like you're ready to eat now?
Yes, ma'am.
Okay, well, I will bring in your tray. Is there anything else I can do for you?
I don't think so.
Okay. And students, the only way you're going to learn how to do this is to practice it. And that doesn't mean standing at the bedside watching your classmates do it. That means you doing it. You have to do it in order to be able to become proficient at it. So I encourage you, we're going to give you lab time to do this, to be the student that is proactive and in here and trying to learn how to do this correctly. All right. Thank you very much.